Welcome back now to part 2 of this edited conversation between RSA member Thien An Nguyen and AAEM board members Kevin Reed and Bob Frolichstein. They'll discuss what's kept them both interested and engaged in our specialty across several decades. I'm Gary Gaddis. I'm the co-chair of AAEM's Aging Well and Emergency Medicine Interest Group. On behalf of our interest group, we hope that you will learn some strategies that you can adopt for yourself toward increasing your career satisfaction from our engaging yet demanding specialty. Thank you.
Hi, everyone. My name is Thien An Nguyen. I'm an MS2 at the Ann Burnett School of Medicine at TCU in Fort Worth, Texas.
My name is Bob Frolichstein. I'm a community emergency physician in San Antonio, Texas, and been a member of AAEM since 1997, I believe, but been actively involved probably the last 10 or 12 years. Been on the board the last 6, I think, or 7 years, and the current president of AAEM.
I'm Kevin Reed. I work at MedStar Georgetown University Hospital in Washington, D.C. I've been practicing emergency medicine close to 25 years come July. I've been active with AAEM in various boards for probably about 15 years, and most recently was elected as an at-large board member about a year ago. Also joined this committee about a year ago, and really looking forward to our discussion about aging well, emergency medicine, and kind of what that means to us.
How do y'all stay up to date? Is it the same for y'all with emergency medicine? How do you keep moving as fast as medicine moves, especially in a field that is so adaptive and rapidly changing?
I don't know that my approach to the basic emergency medicine has changed significantly since residency. The pathophysiology really has really not changed that much. You have more tools, more treatments available to you, and you do have to keep up with that kind of stuff. And how do you do that? I don't know. You just kind of do it because you have to. I would say it's probably actually a little more challenging for a community doc. I'm in the community than at the academic centers. We occasionally will have residents rotate with us, and I love those shifts because they teach me the newest and greatest stuff, and it's really good. But you just have to do your CME, you have to go to your conferences, and you do have to commit to lifelong learning as a physician. There's the pathophysiology doesn't necessarily change, but our understanding of it will change. Our tools to diagnose and to treat change. And that's good. We're making progress.
Yeah, I would agree. I'm fortunate. Most of the jobs I've had within my group, 2 community sites, 2 tertiary care had residents there. So the latest and greatest is coming from the brightest ones out there. But yeah, you have your CMEs every year. You go to a conference where you get high yield clinical information. Whether you take the high stakes board exam every 10 years or you do the modules now, this continuous certification model keeps you there. But I agree that a dissection is a dissection, right? A STEMI is a STEMI. It's how you diagnose it. Then from there, it's okay. Well, we're not using nitroprusside anymore. We're using these drugs. Or now they want us to give this dose of ticagrelor versus that dose of whatever. That just kind of changes over time. But yeah, it is a lifelong learning. A lot of it clinical. There's some work you got to do on your own to just kind of keep sure you stay up to date.
Yeah. So you're talking about like how a lot of things, it's kind of like I think it was way early in the conversation. You talked about how an appendicitis is another appendicitis, just a different patient. Is it at one point in your career to where it becomes too monotonous to where you think it's easy to generalize stuff? How do you fight that? A lot of burnout does come from you generalize stuff. You're like, oh, this again is appendicitis. How do you fight those generalizations and keep every case new?
Again, I think it's about the people. You make it about the people. And I will add that you have to be really careful because a lot of this job is pattern recognition. And once you've seen 500 people with appendicitis, it fits that pattern. But you also have to be really careful to not just lump them there and think through the rest of the differential diagnosis, or you're going to miss something because everything that looks like an appendicitis is not necessarily appendicitis, or maybe that's not a good example, but you know what I mean? You have to be cognizant of, once you gain enough experience, you have to be very cognizant of the fact that there's a name for that error in critical thinking, but lumping them in closure. 20 seconds into the encounter, you've already determined they have this. You have to be cognizant of not doing that as you gain experience.
That's about what you say. It reminds me of my first boss who hired me into MedStar. He came up when I was at University of Maryland, I think my third year, to give a talk on chaos theory and how it applied to the ER. And you're like, wait, where did that come from? But it actually does, when you talk about the spokes of the wheel, you change one spoke of the wheel and all of a sudden the gears are all off. How ER is like that. When you're talking about the same patient, I agree it's about just that interaction with that patient. But he mentioned that talk. He said, what you need to be aware of is not the typical presentation of an uncommon disease, the zebra. We're always looking for a zebra here or there. It's the atypical presentation of the common disease. And that's where that kind of pattern recognition comes in of, okay, I've seen 500. Why is 501 different? The idea of putting a square peg in a round hole for a diagnosis is never good in the ER. And that's where you keep your mind open to what else it could be, so you don't miss the torsion. You don't miss something like that. It's in there, but you hadn't really thought about it right up front. But you step back and say, yeah, I think I need to look further. Yeah, just keeping your mind open.
So this chaos theory, I feel like that is something that a lot of people are scared of. What keeps y'all grounded? Have you always been people that are good at compartmentalizing and very cool, calm people? What keeps y'all grounded in such a chaotic setting? What keeps you sane, really? It keeps you normal, Doc.
Yeah, and that's a good question, and I don't know the answer. I will tell you that I am kind of known for remaining calm in those code situations, even compared to some of my colleagues. But I have no idea. I really don't know why. I think if I were to think about it, it'd be like, well, okay, if you're not calm, what benefit are you or who are you benefiting if you're all up in arms and
It's important.
you're not benefiting anybody? But I don't really know how I approach that. I don't have a good answer for you. Sorry.
Have you always been like that, even from PGY1 all the way to PGY 34, or do you think it's evolved?
I'm sure it's probably evolved, but I think outwardly, I don't know that I've ever been not seen as calm.
Yeah, I think most times I'm usually pretty calm in the setting of the fire, as it were. And I think it's multifactorial. It's one, your mentors who you identify with, the people who always seem calm during your training program, you kind of wanted to emulate. Those who were a little more frenetic, it seemed like a much more anxiety for the whole team. And I guess that's part two is technically you are the team leader there. If you're the attending and you're the only one around and everybody's looking at you, you got to be on your A game. Being able to take a deep breath and just kind of control the chaos as much as you can. Because that's really what it's about. You're not going to fix the chaos. You can only help control it as much as you can. So I think it's the mentors who taught you, and there is definitely a personality in there. We have some attendings, in our group who are a little more, not anxious. You can see get a little more flustered sometimes. I think every group has that. And each of us gets flustered. I'm sure I've been flustered a few times. And someone says to you, are you okay? And you're like, oh, yeah, I'm good. So obviously there's little cracks here and there. We'll have a day where we're a bit flustered.
Like, what are you talking about?
Yes. But yeah, I think it's the training. Part of it's definitely personality, pretty even keel most of the time. And you're kind of a lot of times just the head of the ship with your team. You got to make sure you keep everybody on track.
Yeah, for sure. That's controlling the external chaos of it. How do you control like the internal chaos, like within yourself? Because y'all do seem like very calm, cool, collected people that people trust their lives with because they're like, oh, this person seems like they know exactly what they're doing. But internally, I guess all of this is about aging well in medicine. How do you keep yourself okay at the end of the day?
Loaded question.
It's the secret to all of this.
As far as in the heat of the moment, you kind of asked some of the questions just about, you kind of do have to kind of keep yourself in a calmer space to be able to do the job and get through the day to day. Long term, you kind of talk about, do you bring work home with you? I think if you bring it home all the time, that's going to eat you up inside, leads to burnout, frustration. If you're having challenging shifts where every shift seems like battling with patients or battling with some process or getting somewhere ready to go. So being able to be flexible and that resilience from shift to shift and day to day, month to month. And I think a lot of the ability to do that is what happens outside work. Fortunate, I have a wife who still is happy to keep me around, which is pretty nice after 25 years now. And a healthy family. I've got my own health. I work hard to do that in my spare time. I do different things to enjoy and relax. I like to swim. That's my thing. Training now for a long open water swim next weekend. So a lot of time focused on that. So I think it's just finding joy outside of work and being able to keep it the frustration or just whatever's going on at a shift. Some shifts are very calm, some are not. Be able to kind of keep that under wraps, at least during the shift, to process it and you refill your batteries when you're not at work, depending on what it is. Some shifts you walk home, wow, that was an awesome shift. Or that was one of the neatest shifts ever. I finally saw that diagnosis. So there's definitely some recharging that can happen at work, but I think a lot of it probably happens outside of work. Yes, that's my.
Yeah, it's a very difficult question. And I think Kevin hit on something. I think it's two different answers. At work, I guess I take solace again in that I'm well trained, went to a good residency program. I care about people and I try to do my best. And at the end of the day, that's all anybody asks of anyone is to put in the time and effort to gain the knowledge and apply it in the best way that you can. And that's probably how I get through those tough shifts. But like Kevin, if I just think about the fulfillment I have in my life and the joy I have in my life, certainly at work is part of it, but it's a small part. It's my wife of 34 years and my four now adult, wonderful kids. And that's just really what's in my relationships and outside of work and all that. And that's really what gives me the joy. It keeps me going.
Yeah, that's lovely.
Absolutely.
I think even as a pre-med a couple of years ago, super young, they talk about like really appreciating what's around you and like the little things. I remember I was just so shocked. This doctor was like, sometimes you just are excited for that dump at the end of the day that can bring you some joy. And I was like, what? But really it's the ones around you that makes all the difference. So building that network for sure.
Agreed.
When y'all entered emergency medicine, did you expect to last as long as you did?
I think I did. I really have never considered doing anything else. And I think I went into it thinking that was what I was going to do for my career. And at some point along there, I thought I might be able to retire real early and that kind of stuff. But that changed mostly because of circumstances. But I don't think I ever went in there thinking, okay, I'm only going to do this for 10 years. It doesn't seem like that's a good approach. I think when you enter into hard work that you're doing right now in med school, a harder work that you're going to do in residency. Sorry to tip you off, but it's harder work in residency.
I didn't say that.
It's different. It's different and you'll like it probably better, but it's harder work. If you're putting in all that hard work, I don't think it makes sense to do all that thinking, oh, I'm only going to do this for 6 or 8 or 10 years and then move on to something different. It doesn't make sense to me.
It's similar. I don't think I entered emergency medicine thinking I have an expiration date kind of thing. I always planned to be the ER physician. As things have changed, I'm doing more administrative. I'm still more clinical administrative. It might change in the future, but I think I would always want to try and do ER shifts if I can, even if it's just a few, just because that's the reason why I'm still in medicine. And it'd be very tough to walk away from that, I think. That'd be hard to not be able to see patients clinically because that's the joy of the job is seeing the patients.
Yeah, absolutely. It's not really thinking like an expiration date, but I guess sometimes I look at the burnout rate and it is daunting because you see that people last for such a short amount of time. And yeah, we're in school for so long. So I'm like, I'm learning a lot and I want to do something I love that will last long. Were y'all ever even afraid of that burnout? Was it a concern of yours entering emergency medicine?
I can't say that maybe I was too naive, but it really didn't factor into my decision. I actually don't even know if I was aware of what burnout was or people were burning out. I just thought this is what I need to be doing in my life. And so I just approached it that way. But I will tell you, and I have some younger colleagues in my group that have said, oh, I plan on doing this for X number of years. And it's usually 20, not 10. And 20 is a good long time. I think I can retire and not see patients clinically anymore. Okay. Because I think I can get the joy and satisfaction from helping people in other areas outside of the emergency department. I still want to do that. I still want to help people, but I think there's a lot for me personally. I think there's avenues I can do that outside of the emergency department. So I don't think I'll miss it necessarily. I could be wrong, but we'll see. But I never really went into it planning on, oh, I'm going to do this for a while and then switch to another career. Now, a lot of people some other career falls in their lap. And so they quit doing emergency medicine, and those count as burned out people that skew the statistics. I don't know how many of those are and what the statistics are, but yeah, I don't. Bottom line is it's a tough job, but lots of jobs are tough. Lots of jobs are tough.
Yeah, burnout is, I'm guessing each one of us at some point in our career has some of the signs or symptoms of burnout. It's a matter of how much they continue to grow and impede on your ability to be a physician at the bedside. Again, I would say that the most challenging times I've had while being an ER physician were more on the administrative side. So I think on that side, I've had some of those symptoms of burnout, but that was because of what was going on with that issue, not my day-to-day seeing patients. You was able to kind of work through and you maybe do a different career. You take a lateral move or you step away for a little bit, or you change what's going on, or you give up an assignment or something to kind of help you work through that. I think the biggest thing about that is recognizing that it is real, to being open, if people are giving you feedback that there are signs that are there, and getting help to hopefully get you through that. Yes, we don't want to train outstanding physicians and only have them in the field for 10 or 15 years, because that's a huge expertise and knowledge and caring person that's no longer at the bedside. And we need, unfortunately, more people, I think, to be at the ER bedside as physicians. But it is good that I believe it's very healthy that it's much more present, being recognizing that it's a real thing and not just saying, suck it up. That's not what it should be. It should be, well, let's talk about it. How can we work you through that? I guess it's kind of made me think again of, and I'm definitely dating myself here because I think it's from the 90s, a movie called City Slickers. And there's a scene where there's a dad on this experiential trip trying to find out joy in his life. And one of the head hands puts his finger up and says, what's the happiness of life? This. He puts up his finger and he said, what's that? He's like, that one thing. What is that one thing that brings you joy in your life? And that can change in life. ER work, administrative work, whatever it is, that's your work joy. But the joys of family, friends, playing guitar, writing a book you've always wanted to do, doing stand-up comedy, whatever that is, there has to be that joy there. And I think that's what kind of keeps going through, is having the joy in the day-to-day from the small conversations with a patient or family or your staff, making a new process better so people are happier or more efficient, and finding that joy outside of work. That one thing, which can change, but should always hopefully be one thing that keeps you going.
I see. So what are the thing? What do you think it is?
For me, it's relationships, and both in work, with patients, with my colleagues, but mostly outside of work with my friends and family.
Echo exactly what Bob said.
Yeah, no, absolutely. But definitely some of it, well, that's your one for sure, but you still look forward to going to work as well. So what's your in work, do you think? Is it the same?
It is for me. It is for me. And I think it's, again, maybe early on it wasn't that. It might have been more about the glitz and glamour and that kind of stuff. But for sure, it pretty rapidly evolved to relationship.
It's the continuing to enjoy the patient there, but again, that's relationship with the patient or family. But it's the team around you every day. They're amazing. They're awesome. They work hard. They work really hard. And you're right there with them, and you're sharing the highs and lows of it, and the holidays and the overnights and the weekends with people barbecuing, and you're at work at 7 p.m. on a Sunday evening. That's the job. That's the team you're in. There's a lot of joy, just day to day, the small moments with the teams, I think makes it work.
Yeah, no, that's wonderful. Do y'all have any advice of anything you learned over the years to yourself when you started out?
Well, this isn't really advice, but earlier you said something like you feel like you're wasting your time learning all this stuff. You're definitely not, okay? Because there's pathophysiology stuff that just doesn't change. Anatomy stuff just doesn't change. And the key thing that you're learning right now that you probably don't even know is you're learning how to learn. And that is a skill that you need for the rest of your career. Don't ever think, all this stuff I'm learning is going to be outdated. Sure, some of the facts are going to be outdated. People aren't going to check their blood sugar in another 10 years every day. They're just not going to do that. And so that kind of stuff goes out the but you're learning to learn, and the basic stuff is still there. Anatomy changes, but it takes millions and billions of years.
Well, you think back to like pre-calculus or statistics or geography, like all those things I feel like don't exactly apply to medicine, but I do think they like shapes me as a learner. I feel like that might be medical school transferring in. And it's way more fun now learning about the human body because I do see the relevance to the rest of my life versus I used to study geography or stuff like that. I'm like, why do I need to know this? Mom, don't make me learn.
Yeah.
But lifelong.
Yeah. If you talk to myself 25 years ago, one thing might just be don't be so hard on yourself. There are going to be diagnoses that may not come into your head, or something changes. You didn't think about something, or just in your own personal life. We're not always going to be right. And that's okay. You learn from it and you move on. So don't be so hard on yourself, because we're all probably a bit type A and going into emergency medicine and medicine in general. So we're always going to be hard on ourselves. So that'd be one thing. I think the other thing is also realize there are plenty of personality trait scores and things you take to learn about yourself. And one thing, I'm a pleaser. I like to hopefully make people feel better and make them happy and personal life, et cetera. So you can't always please everybody. There is no way you're always going to fix everybody or make everything perfect or solve every problem. So that's okay. You can't please everybody. You do the best you can. You're well trained. You've got the goods. You can do it. Just realize you can't please everybody, and that's okay. Nobody's perfect. Don't be hard on yourself.
We hope you have enjoyed this podcast from the American Academy of Emergency Medicine. AAEM is a nonprofit professional association of over 8,000 emergency physicians dedicated to board certification and democratic group practice. For more information about AAEM, visit our website at www.aaem.org.